I'm Sohee Park from Yonsei University Hospital in South Korea. What I'd like to present is one-year outcome of multiple blood-brain barrier disruption with temozolomide for the treatment of a glioblastoma. GBM, one of the most common brain tumor, is lateral malignant. Prior to the release of temozolomide, it had an average survival of 9 to 12 months. After the introduction of temozolomide and the currently used regimen, the median survival has increased up to 14.6 months. It is generally known that the TNC partially passes through the BBB, but the concentration of TNC in brain tumor tissue is about 20% of the plasma level, and even with the concurrent radiation therapy, the concentration may rise only up to 35% of the plasma level. However, with BBBD, it was reported that the increase was about 7.7 times. Therefore, we performed the repeated multiple BBBD with MRGFUS to increase the delivery of chemotherapeutic agents in patients with GBM during standard adjuvant temozolomide chemotherapy. This is outline of our study. We performed BBBD during the 6th cycle of standard adjuvant temozolomide chemotherapy. BBBD was performed on the first or the second day of the chemotherapy cycle. A total of 6 patients were enrolled. 5 of them underwent a total of 6 cycles of BBBD during TNC chemotherapy. 1 patient dropped out after 3 sessions of BBBD, but the patient still continued with the chemotherapy. The average follow-up period of 6 patients was 15.17 months. The first table is the demographic of patient, and the second table shows the number of BBBD targets we performed and the number of BBBD confirmed on post-sonication MRI. In the picture on the right, the first row is pre-sonication MRI, the second is post-sonication MRI, and the third one is pre-sonication MRI before the next BBBD. As you see in the post-sonication MRI, BBBD was confirmed but not observed afterwards. This picture shows the recurrence and survival of 6 patients. Patients number 2, 3, 4, and 5 completed 3 or 6 cycles of BBBD without any adverse events or recurrence of the tumor and have been observed as stable disease states. The picture on the top is patient 1. 2 months after the completion of BBBD, the patient demonstrated a mild right leg motor weakness. Pseudo progression was diagnosed with MRI. After steroid therapy, the NS lesion showed a decrease in size on follow-up MRI. Over time, the symptom reappeared, and a follow-up MRI showed a recurrence of GBM at 16 months from its first diagnosis. The patient was restarted with TMZ. The picture on the bottom is patient 6. After completion of chemotherapy, the patient showed a stable disease state without evidence of recurrence. However, 2 months later, the patient complained of left motor weakness and a recurrence at the right temporal lobe was observed on follow-up MRI. Surgical resection was done and chemotherapy is in progression. 2 patients showed a recurrence of tumor at 11 months and 16 months respectively, and the other 4 patients are on observation without recurrence. The survival rate up to 1 year was 100%, and none of the 6 patients had immediate or delayed BBBD-related complication. GBM generally recurs at a median of 7 months after primary treatment and has an average survival of 12 to 14 months. And in a recent meta-analysis for the survival of GBM, when gross total removed, the progression-free survival is 66.5% at 6 months and 46% at 1 year, with 55% of 1 year overall survival rate. All 6 patients in this study underwent GTR of tumor. Although 2 of the 6 patients had a recurrence, they showed 100% of 6-month PFS and 33% of 1-year PFS, which is better than the previous reported meta-analysis. The average PFS of the patient who had a recurrence was 13.5 months, whereas the others showed a median progression-free survival of at least 15 months. This is twice the previous reported PFS and is likely to increase. In addition, the 1-year overall survival was 100%. Regarding this result, the survival benefit of additional BBB to increase the TMC concentration may be considered. In conclusion, multiple BBBs can be regarded as a safe procedure without long-term complication, and it seems to have some survival benefit. However, since TMT partially crossed the BBB, further extended study with large number would be needed to evaluate the benefit of BBBDD. Thank you for your attention.